mental health awareness helps to reduce social stigma and also helps to reduce self-stigma in society.
So once you're mentally aware, it gives you, so many opportunities. One, you're able to understand certain illnesses. Two, you're able to help yourself or help a loved one. Three, you're able to manage situations before it gets out of hand.
People become more sensitive when they have an idea of what mental health is.
You know what it is to be mentally okay, and you know what it is to not be so mentally okay. You can quickly seek intervention, when things are not going on so right.
Mental health awareness also enables society to take appropriate positive social action. I'm talking about advocacy.
10th of October each year marks the World Mental Health Day. This is an international day for global mental health education, awareness, and advocacy against social stigma. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health, a global mental health organization with members and contacts in more than 150 countries. On this day, attention is brought to mental illness and its major effects on people's lives worldwide. World Mental Health Day is supported by WHO through raising awareness on mental health issues using its strong relationships with the ministries of health and civil society organizations across the globe. Every year there is a World Mental Health Day theme, and this year is themed Make Mental Health and Well-being for All a Global Priority.
For me, it feels like this theme is just for Nigerians because, in all honesty, or for Africans, in all honesty, we're lacking behind when it comes to mental health. A lot of people don't feel the need to take care of their mental health because they don't even think it's actually something that needs to be addressed or taken care of.
Mental health since I can remember, has been relegated in talking about health in general. And so making mental health a global priority means that we don't just see it as a Western phenomenon anymore. People used to have the idea that in our part of the world, in Africa, that we are immune to mental health conditions.
We should make mental health a priority for every living being. The same way we are running after making physical health important. We want to eradicate malaria, we want to eradicate HIV, AIDS, we want to all of these diseases. It's also important that we pay the same attention to mental health and make it available for every single person. It's not only adults that have mental health issues. The same way children have physical health issues, they fall down with malaria, they fall down with, maybe stomach issues or something like that. Children too have mental health issues.
What this year's focus is how mental health can be made relevant in homes, in schools, in our worship places, in workplaces, and so on and so forth, and even in politics.
I know there was a time that people used to say, people commit suicide, right? They say people commit suicide. How do people do that? But almost every day in the news now, we hear that people are dying by suicide. And so people now begin to understand what's going on. They say, is it economic problems and everything? And then they get to now hear that, there's something called depression, right? That awareness is coming in bits and pieces. Now imagine if it was made a global priority, where it is prioritized as the period where diseases such as HIV and tuberculosis and influenza, when they were prioritized at the time, even when COVID was.
Mental health issues can be managed for those that cannot be cured, and some can actually be cured. So we should definitely make mental health accessible to everyone. The awareness, the diagnosis, the intervention, the treatment, follow-up practices. And we should begin to even make it an holistic thing. More like, the social worker works with the psychologist, works with the psychiatrist, works with the occupational, all sorts of psychologists that we have, occupational therapists and all of that, work together to make every individual better. Having that open access to everybody is very, very important. And I think in this 21st century, it's high time we begin to take mental health issues very seriously.
According to the World Health Organization, Nigeria, which is the 7th largest country in the world, has Africa's highest caseload of depression and ranks 15th in the world in the frequency of suicide. It is estimated that fewer than 10% of mentally ill Nigerians have access to the care that they need.
Maybe I'll rate Nigeria at the level of 2, and I think I'm being generous. At the level of 2, because we can do so much more. We can do so much more. It is not, for example, it's not all NHIS, that's the insurance that covers psychological issues. Even private insurance, some of them that cover psychological issues, cover the very, very, very basic. In Nigeria, we don't have enough specialist centers that are for mental health issues that people can just walk into and get attended. A very few. Okay, specialist centers for special issues like maybe adolescent issues, maybe neurodevelopmental issues like all of those cerebral palsy, autism, and all of that. We don't have so many specialist centers.
Currently, there's still no mental health legislation in Nigeria as we speak. In the federal government cadre. Thankfully, some states are already adopting mental health laws. Lagos State and Akwa Ibom are the ones that I can remember off the top of my head that have taken mental health legislation into serious like they've taken it seriously, let's put it that way.
The state of mental health in Nigeria, it's something to be looked upon because one, we have little to no availability, mental health services availability, and if we check that, it's something that it's very rampant. For every 4 persons, 1 person is dealing with mental health, mental illness. But we live in a part of the world where these things are not addressed. We live in a part of the world where mental health services are not priorities. We live in a part of the world where a lot of people are not mentally aware.
So the state in Nigeria is really, really poor. It's getting better. It was worse than this 5 years ago, really terrible 10 years ago. It's getting, but we are taking little, steps. It's very, very minimal.
In the past 20 years, we have seen the transformation of hospital services in such a way that they have included, mental health as an integral part of most medical services. And I think that is one area of commendation for the Nigerian government. And then 2, specialist hospitals have been created for just to address mental health issues. So we have neuropsychiatric hospitals in all the geopolitical zones of the country.
would say one thing that is very significant is the influx of non-governmental organizations that are specialized towards mental health. They make sure that they prioritize mental health in their own way, and just the impact of these mental health organizations have made Nigerians more aware about mental health.
5 years ago, we're not here. 5 years ago, somebody would not point out more than 3 private facilities that deal with mental health. But we've come this far that left, right, and center, maybe one place or the other, you could find access to mental health services.
The Nigerian media has been extremely outstanding in promoting advocacy and awareness, on mental health, to the extent that the level of stigma for mental health conditions has dropped significantly. I think on a scale of 10, whereas stigma was 8/10, we now have 4/10. It has crashed.
A lot of people are beginning to train to become professionals in mental health right now. Usually, people would shy away from courses like psychology or even psychiatry in medical school. But today, people enthusiastically show up and say, this is what I want to do for a career. Every individual, everyone has a collective responsibility to prioritize mental health. However, different people hold different positions, power, and authority to make mental health bigger than what it is right now in Nigeria. For instance, if people in professional settings, say HR and employers, have a mental health policy in the workplace, right? In that way, they have prioritized mental health. And then it makes it have a bigger representation in the workplace. If schools are very intentional about having some policy that promotes mental health, it has done something for that institution. How about at home? Or say people, if they have family doctors, and then for every time people visit the hospital, there is a form of like a mental health checklist, as little as in the primary healthcare centers. It goes a long way, it exposes mental health the way it should be. But you see, all these players, without the key player, which is the government, will just be trying, in some sense, to make something work. The government bears the larger form of responsibility because of the resources they pool, the authority that the government has, and the stakeholders that they have as well.
The federal government can begin to subsidize mental health intervention for people, for example. They can even assent to the bill that has been on the table for a while. They can, make laws. They can go all out, begin to orientate people, awareness. They can employ psychologists.
There's a gap, and the gap that exists is what we who are mental health practitioners must consciously bridge now, and that gap has to do with attuning ourselves to the cultural conceptions of mental disorders so that we can respond appropriately to the needs of people who are down there at the grassroots. Whether we like it or not, just cascading mental health skills and knowledge to people at the primary healthcare level does not really translate to, accessing people who need care and providing the care for them. We have to get to them where they are at, try to know what they think about mental health disorders, try to study their attitudes towards mental health and their belief systems, and then enrich their help-seeking patterns, win their confidence and enrich their help-seeking pattern.
As an individual, I don't need to be a mental health practitioner to be able to, say one day if I am able to have this amount of money, I could start up an NGO that deals with mental health, or I could start up a facility that gives, little to nothing services, required services for mental health, for the less privileged. So if everyone would come on board to create that change or to create a difference, if everyone would come on board to say, okay, I for one, I have the resources to start up a facility, or I have the resources to support someone who has this facility, or I have the resources to help the government, because we're dealing with a society where everyone is waiting for the government to do something. So I would not just say this priority is limited to the government. It's open for everyone. If I would give a little change, another person would give a little change, another person would give a little change, it would become a very, very big change for us.
Nigeria's mental health legislation was first enacted in 1916 and was called the Lunacy Ordinance. In 1958, these laws were amended to give medical practitioners and magistrates the power to detain an individual suffering from mental illness, and is called the Regional Lunacy Act. Since then, Nigeria has not revised its mental health law, and the fight for the passage of the Mental Health Bill remains an ongoing struggle.
Ask me, the first thing is for us to place a premium value on what mental health is, and then set those goals. Goals are not just dreams. They are things that people work towards, and they must be time-bound. And people achieve their goals if they take them in bite sizes, in bits and pieces, before they scale. And so what I would say is the way forward is for the Nigerian populace, the government, parastatals, private and public, to be intentional, take a leap of faith and learn about what this mental health is. Implement it and see whether it works or it doesn't work for you as an institution or for the people in the populace. Just take a leap of faith, put it in your plan, invest in it more than ever before.
The federal government should ensure that it makes provision for manpower training for our colleagues who need to improve their knowledge outside this country, so that we will all be exposed to the different modes of practice and the different knowledge systems that are required.
Subsidize, some of these treatments, especially when we make it accessible, like the federal government makes it accessible in more centers. And then if people know they can walk into general hospitals, for example, and can see psychologists. I don't mean seeing only psychiatrists, but they can walk in, they can get access to social workers, they can see psychologists, they can see all of that. It makes it easier. People begin to talk more about it. Advocacy, very, very important. Very, very important. And then individuals too begin to take responsibility for themselves. It's no longer a time where we continue to be hush-hush about mental health issues, or we don't take responsibility for ourselves.
If mental health would be able to have its own budget, I think that would go a long way for mental health services in Nigeria. With that, you realize that there are more practitioners, getting paid to be in those services. There are more hospitals, facilities that would be able to provide those services. And then there would be little to no cost affordability for people who can't afford to get these services.
Mental health practitioners begin to take a lead and not wait for government in proposing policy perspectives for the provision of mental health care in the different segments that are required, on substance abuse, on maternal mental health, on child mental health, on adolescent mental health, and on workplace-related mental health issues. We must begin to generate policy options that will guide government rather than just waiting for government to think about mental health.
I also want to stand with professional improvement as well. If there is, something that helps us improve our curriculum, we are deliberate about research and development and curriculum improvement as a nation, we would have more people who will be interested in coming into the field of mental health. There will be more interest in learning about what we can do to make mental health a priority.
So parents too should begin to encourage their children to go read psychology, go read guidance and counseling, go read social work, go read. I know that, for example, a lot of doctors don't want to become psychiatrists, but we need to begin to encourage people to go read psychiatry too, because it's very, very important that we have professionals handling those things. And then another thing is that media houses, should do more. People should create more movies, for example, that showcases mental health and proper intervention, proper line of intervention. People should begin to, of recent, I see that some movies are beginning to come out to show some of these things. But we need more. We need more people to be aware. Let us have movies that depict couples therapy, family therapy, movies that depict children having autism, how they cope, what are their life issues, documentaries like you are doing, More people need to come out with things like this.
Every hand must be on deck. All hands must be on deck to ensure that mental health is a priority, from the individuals to the family to the schools to the institutions to the organizations to government, public, private enterprises and the likes. If we all put our hands on deck, prioritize it, give it some time, watch for the things that we can use as indices for growth, I can guarantee that Nigeria will become a more mentally healthy environment.